Saint-Gobain are a world leader in everything they do. We see our health and wellbeing programme as a differentiator in terms of how we can add value through return on investment, through better customer satisfaction, and for more engagement and motivation for our employees to do a good job. Some of the challenges that we've faced in implementing a health and wellbeing programme across our 36 businesses here in the UK is that traditionally and historically we've approached it in a fragmented way, not driven by data we derive from our people. Health and wellbeing to Saint-Gobain is a core value, and it's not something that we see as a gimmick. It was important in the partnership that we had with AXA PPP Healthcare that we gained trust within our workforce, and we were able to develop a programme that was simple and user-friendly, that we're able to roll out across all our different business units, and we also were able to brand it so people recognise what the programme entailed. The programme that was developed with AXA was called Fit for Work, Fit for Life, and it was a three-tier programme around raising awareness, engaging and sustaining the efforts. The awareness stage was to put in place the Health Gateway, which was able to capture data and information from our employees for us to make informed decisions in terms of the lifestyle, disease and psychological risk profiles of our organisation. And with the support of the Health Gateway, we were able to get people to interact and get information about their health risks and their health challenges in order for them to take informed decisions around what action they needed to take to improve their general health and well-being. There's an old saying that if you can't measure it, you can't manage it. And it's important in the way you collate data that you have that insight and that information to hand to make informed decisions to really make real differences in our workforce. Somebody like Rachel is a great human example of how a serious approach to health and well-being can make a tangible difference to an individual's personal life, but also in terms of their workplace commitments.
Our department decided to get AXA in to do a health check. It was frightening with cholesterol and with blood pressure and obviously the weight. I knew that was going to be big. So it wasn't a huge shock, but it was enough to give me that state of mind. It's right, okay, you need to sort this out now before it gets any worse. Over the course of a year, I've lost 4 stone, 6 pounds, and the Gateway's been a big help. You can track what you're doing, you can see where you're going wrong, and you can change it. I know when I was larger, I was really unhappy. And I think that comes across when you're at work, that you're probably not giving what you can because you're not happy within yourself. It needs addressing, it really does. And I'm glad I work for a company that does address it.
And I think we're seeing that in our organisation, people who are more engaged with their own health and well-being. We're seeing happier people and we're seeing better teamwork as a result of that. And we see some really impressive returns on that investment. It was also important in Saint-Gobain that we were able to get executive buy-in and senior key stakeholder engagement with our programme. And that really has helped us to embed it in our organisation in a proactive way. One of the key outcomes that Saint-Gobain wanted from our health and wellbeing programme was to create an environment for success where people were able to contribute and were engaged and motivated to go the extra mile to do the good jobs that we need to do in Saint-Gobain.